The next question is, can a dentist diagnose sleep apnea?
Awesome question. No, you are not allowed to diagnose for sleep apnea. How we look at a pediatric patient is basically sleep apnea is a designation that basically only 1 to 2% of the population have. And they usually accompany with a sleep testing and a sleep physician being able to document it. When we have our sleep questionnaire, there are certain questions in there that would pose a problem. And you as a dentist are able to screen for sleep issues. Now, when we're screening for these outward symptoms, but what we're looking at is the underlying root cause. And that, as a dentist, you are able to evaluate and treat day in and day out. If we see a child that stops breathing for a significant period of time, obviously that's a much more serious condition, and we'll have appropriate procedures of how we would handle that. And we would suggest that obviously we're looking at tonsils and adenoids and seeing if that needs to have a referral to an ENT. We would also look at it from a standpoint that we're maybe having a sleep physician also look at it. Maybe a sleep test would be in order for that particular patient. So again, as a dental professional, you need to be very careful that you are not diagnosing sleep apnea. I shy away also from the terminology of curing sleep apnea. We do not cure sleep apnea. We basically reduce the outward symptoms that we see in sleep disorder breathing by evaluating and treating the underlying root symptoms.